So I'm Dr. Kerri Neylon. I'm a GP in the south side of Glasgow and Associate Medical Director for NHS 24. So first thing to say is eating disorders can affect any person and at any time in their lives. So it doesn't matter your gender, your ethnicity, it can affect anyone. Most common is in youth and adolescence, and often at a time of change it can occur. So I think if you're concerned about your eating, or people around you are also concerned about it, then you can look online initially at the NHS Inform website, where there's a huge amount of resources. Allows you to have a look and pinpoint yourself if there are things that may be concerning you and help you understand why they may be concerning. Following that, the best thing to do would be to make contact and see a GP. They will be able to speak to you directly about your symptoms and really try and assess where you are and think about next steps from there. Importantly, you can take someone with you to that appointment if that's something that you would feel most comfortable with, particularly one of your loved ones who may also have concerns and may also be able to add to that and provide additional information. It's really important not to be nervous. Appreciate that you might feel anxious talking about things that are very sensitive to you, but your GP is really willing to listen and to work with you to work out what's really important for you. That might not just happen in one consultation, maybe over a course of consultations where you can build up more confidence with your clinician. Evidence shows that early intervention with people with eating disorders gives a far better outcome. So please don't hesitate. Make contact with your practice and get an appointment to see a GP to talk about how you're feeling about things. Following that, the GP will then make a plan along with you about next steps. Sometimes that might be doing blood tests, sometimes it might be thinking about medication, and also sometimes might be thinking about, do we need to refer on to other specialist services? If someone is very unwell, it may be that they need to be referred in to our medical colleagues in hospital, but most times we would be referring into specialist services within our mental health services for them to carry on doing further assessments and additional input. So specialist mental health services relating to eating disorders are quite wide-ranging and may require psychological therapies like cognitive behavioural therapy. If you have significant challenges with an eating disorder, you may require quite significant amount of input with that comes from specialist mental health services. The requirement for emergency care with an eating disorder is not common, but it does happen. If someone becomes very unwell, so very faint, passing out, or very dehydrated, then that's when they should seek emergency care. That would be through phoning 111 or for phoning 999 for ambulance or self-presenting at an emergency department.